Good afternoon, everybody. Thank you for joining us. We're so excited because today we are going to introduce the Volunteer Driver Program Toolkit. It's pretty new, and it's a joint project of National RTAP, Washington State Department of Transportation, CASTA, Colorado Association of Transit Agencies, prepared by KFH Group and Socus Amica, and funded by FTA. The recording and slides will be posted on the National RTAP webinars page within a week of today. If you have questions at any time, please answer them in the Q&A box on Zoom. Questions will all be addressed at the end. You can also chat with us if you're having difficulty with the webinar. At the end, you will be given a QR code to fill out a very brief post-webinar survey. We hope you give us feedback. It really helps. And if you can't get to that, you'll get an email tomorrow with the survey link. Please follow our website and e-news for additional webinars or workshops on this and many other topics. So for those of you who are new to National RTAP, we are a National Rural Transit Assistance Program. We're a technical assistance center funded by FTA through its Rural Section 5311 program. We provide free training materials and technical assistance to rural and tribal transit providers and to state RTAPs. We're governed by a review board, 14 state DOT and rural and tribal transit agency managers from across the country. We currently have a solicitation out for new review board members if you're interested in joining us. Learn more at nationalrtap.org. This shows a picture of our homepage. What do we do? All kinds of things. And I did mention it's all free. We have training in the form of manuals, videos, slides, e-learning, and more. Information and best practices like tech briefs, toolkits like this one, and more. Technology tools for procurement, cost allocation, all kinds of things. Peer networking and training via webinars, conferences, roundtables, etc. And assistance through reference services and technical support. Bring us your questions today and every day. National RTAP also administers TACL, which is a training and technical assistance coordination library, and it's all about transportation coordination. There's the URL. So very excited to introduce today's panel. I'm Kara Marcus, Knowledge and Resource Manager for National RTAP, joined by Mariana Hannafeld, Tribal Liaison and Washington State RTAP Manager from Washington State DOT, Meredith Green Madrigal, Principal and CEO of Socus Amica, and Paula Clark, Senior Transportation Manager from KFH Group Incorporated. Now let's learn about the toolkit preparation team. Paula?
Hi, thank you, Kara. Well, we had many reviewers and contributors. The preparation team included myself and other members of KFH, along with Meredith Green Madrigal and her team from Socius Amica. Mariana Hainfield, Kara Marcus, and Ann Rajewski, that Kara just introduced, served as project managers. And I would also say they also served as reviewers, were able to quite often provide additional resources. So thank you. Our content reviewers, all of whom provided insightful comments and resources, included Carrie Diamond, who is now with Texas A&M Institute in Texas. Carrie was with the National Aging and Disability Transportation Center at the time of her review. Angel Bond with Boulder County Transportation Planning Division in Colorado, and Stacy Sahu with Hopeling Mobility Management in Washington. And while not listed on this slide, I would like to give a quick shout out to all of those VDP professionals, those that worked with us on the case studies. They offered specialized insight and again, quite often added additional resources for us. Mariana?
Thanks, Paula. Hi, everyone. Mariana Hannafeld. I am from the Washington State Department of Transportation, the Public Transportation Division, and I am the RTAP Coordinator Manager for the the Washington State RTAP program. This volunteer driver program toolkit is near and dear to the hearts of those in Washington State and frankly around the world. The reason I'm here to talk is simply to let you know that this project has been the brainchild of folks in Washington State from the late 1990s into the early 2000s, and was put together by a coalition of nonprofits, human service agencies, and the Department of Transportation. At that time, there was a need to clarify the role of volunteer driver programs in our state and provide them with technical assistance around things like, how to get started and what to do with the management of a volunteer driver program if you've never done it before. And so this document was created at that time. The toolkit was last updated in 2013, so we felt it was time to bring it then to the next level. And we approached National RTAP for some additional funding. We really want to thank Robin Phillips for helping us with our vision, and for Kara Marcus for managing the project on the National RTAP side. Also, a big shout out to Ann Rajeski, who is not here today, from the Colorado Association of Transit Agencies, who also participated with this process and really helped to initiate it along with myself. We're really happy to present this to you, and with a reminder that this is intended for the very, very beginner folks who are starting out as volunteer driver programs. They are maybe not even a program yet. Maybe it's neighbor serving neighbor. And we're very, very happy and excited to present this to you with some wonderful information, great resources, and incredible case stories. Thank you. Let's see, who's up next? I think, Paula, are we back to you? Or is that Kara?
That would be Kara.
Okay. Kara, are you coming back?
Go to nationalrtap.org, mouse over resources, and you'll see a button for toolkits. They're alphabetical. So the Volunteer Driver Program Toolkit is right there at the end. And you can also bookmark the URL at the bottom. That way you'll have it. And like I said, these slides will be available, so you'll get the direct link. Okay. Now, Paula will talk about the welcome section.
Thank you. So section 1 is just that. It's a welcome. It explains the toolkit's purpose. It acknowledges the history Mariana just explained and shared with us, and the people behind the toolkit, and provides instruction on how to navigate through the toolkit itself. Slide. Thank you. Volunteer driver programs are a critical component of many public transportation systems, as well as human services transportation. They offer generalized, specialized, or expanded services beyond those typically available through general public transit. They are also able to provide a more personal and one-to-one transportation service for customers who may require additional assistance. That said, the purpose of this toolkit is to assist organizations with the development and maintenance of volunteer driver programs. This toolkit is a guide that provides a framework for developing and maintaining those programs. Meredith, would you like to share how to use this toolkit?
Certainly, if you'll flip to the next slide. There we go. Okay, so our reviewer team on this project thought it would be useful to include a quick guide on the how to use the toolkit. There is a lot of information in this, and people can get lost, especially if they're new with starting or attempting to start a volunteer driver program. And so this guide can actually be used based on your organization's experience. So while there is a wealth of knowledge in this toolkit for those who are looking to start new programs, we also flagged different sections based on those programs who had previously been established and those who are essentially rocking and rolling and would like to learn from other case studies. So it includes beginner, intermediate, and advanced volunteer driver program sections, and those are flagged. So you'll see that in section 1 of the toolkit. And the goal was to help the reader move from key focus areas, from beginner basics like understanding the legal and insurance requirements and driver recruitment, to more advanced sections in that you can learn from one another, or essentially new things that volunteer driver programs are experimenting with. Next slide. So for intermediate topics, for example, we have them sectioned out, such as like retaining drivers, scheduling technology. When we were going throughout the course of this project, we learned a great deal about various scheduling techniques and tactics, and those can be incredibly useful for those intermediate and advanced programs who would like to learn from one another. So look for that in section 1 of how to use the toolkit. Lastly, the advanced section includes topics like post-sedation transportation. We even have some programs that are dabbling in the possibility of medical escorts. And so there is a lot to learn for those programs that have been established for a while as well, kind of taking your service to the next level, so to speak. Paula?
Thank you, Meredith. So on to section 2. Volunteer driver programs. This section provides an overview of requirements, processes, and procedures known to be of value to existing volunteer driver programs and their sponsoring organizations. It contains information and resources to help organizations navigate through the sometimes complex requirements imposed by federal and state laws and various funding organizations. Methods and practices used by a variety of volunteer driver programs and sponsoring organizations are included as examples throughout this section. This section includes discussion and information about volunteer driver programs, and we say sponsoring, but sometimes supporting organizations, conversation about limiting financial exposure related to risk, discussion about what type of insurance is needed, community relations, the importance of written policies and procedures for both paid employees and volunteers. We talk about funding, local, state, and federal, subcontracted services, and operating across borders, across county lines, across service areas, that kind of thing. And I wanted to also mention quickly here that every section of this toolkit, and this one in particular, ends with section resources that provide links to online resources and quite often to examples that exist in section 7 case studies section. Next slide, please. Volunteer driver programs often fill critical mobility gaps for people who live outside public transit service areas, or they need to access jobs or services outside public transit service hours, or just a need for personal or specialized services to travel. Section 3 contains important information on policies and practices related specifically to riders using volunteer driver programs. This section really focuses on riders, rider eligibility, communications with riders, children as riders. We include rider surveys, some examples, and how to handle rider grievances. Next slide, please. Whether a volunteer uses an agency-owned vehicle or a privately owned vehicle, they are responsible for the safety and well-being of all riders. Section 4 discusses the proper selection and management of both volunteer and paid drivers. It provides examples and resources for driver recruitment, driver selection, and retaining those drivers once you find them. This section provides insight into the importance of having clear policies on driver duties, performance, and conduct. It also contains resources for training volunteer drivers. And again, this section of the toolkit is really linked with the case studies in section 7 for great examples, descriptions, and pictures of the topics in this section. And also, this section is very connected to the forms and templates contained in section 8. Section 5. Day-to-day operations provides guidance on the types of policies and procedures that should be considered for the day-to-day operation of a volunteer driver program. It includes policies and processes related to scheduling rides and the management of vehicles, including privately owned vehicles. This section of the toolkit answers questions and provides information. For example, scheduling questions are discussed in this chapter, in this section. How far in advance should requests be submitted? How should volunteer preferences be taken into consideration? What type of technology should be used to schedule trips? Is there a limit on how many trips a rider can schedule? Is there a maximum one-way distance for trips? Many of the case studies that have provided some thoughts, some guidance, and examples on these questions. Vehicle equipment and maintenance, trip plans, inclement weather, incidents, accidents, and collisions, reporting, and what to do at the scene are among the topics included in this section of the toolkit. And again, examples are included in section 7 and in the forms and templates in section 8. Programs are responsible for maintaining appropriate records and for being knowledgeable about legal requirements related to timelines for maintaining records. Section 6 provides an overview of record-keeping needs and best practices. This section answers questions like what driver records should be maintained and what records should be kept on riders. This section also provides information and guidance on keeping vehicle records for both privately and agency-owned vehicles. And very importantly, this section provides guidance and discusses the importance of performance metrics, how to record trip information. Those topics include trip requests, trip reports, trip denials, late cancellations and no-shows, new and unduplicated riders. Trip purpose definitions are provided for consistency in reporting. Meredith, would you like to share section 7, case studies?
I would. Thank you, Paula.
Yeah.
So let's dig into section 7 of the toolkit. There are a lot of juicy case studies here that we can learn from. So I'm going to talk to you about what is in this section and the best way to access the information. It's meant to reflect all of the many volunteer driver programs that exist across the United States. This section is divided into 3 parts: case studies, common themes, and lessons learned, which are super important, and also includes an appendix. So when we were working on this project, we wanted to ensure that the volunteer driver selections represented a wide swath of geography, to include various regions of the US, such as the Midwest, the Northwest, and the Southwest, for example. And we also wanted to include programs by typology. So that would be rural, suburban, as well as large urban. And so in doing so, we were able to select a variety of programs that you can learn from. And this section includes individual approaches to providing service, relevant policies, funding sources, driver recruitment and retention are all topics that we dove into with these case study programs. And then we gave special attention to each program's background and history. So their ability to provide service to a wider variety of riders beyond the more traditional service that we see to older adults and individuals with disabilities was also explored. So with that, let's dig into these case studies. Next slide. So our first case study is Saint Volunteer Transportation Program in Fort Collins, Colorado. They provide door-to-door service for older adults, typically 60 years and older, and younger adults who cannot drive due to a disability. And their services are in Fort Collins as well as Loveland, Colorado, which is essentially its own city, but because of sprawl, it kind of is like facing like a suburb. The program's structure is simple. They have volunteer drivers that use their own vehicles to provide door-to-door rides, and they have about 90 to 95 volunteers. So they're one of our more seasoned programs. They use a ride scheduling software to manage ride requests, and 2 staff members handle the scheduling, which is primarily done through voicemail. Once a request is received, the scheduler checks the calendar, books the ride, and confirms with the rider. They also participate in the North Front Range Metropolitan Planning Organization's Ride NoCo Information Hub. So essentially that helps potential riders in Northern Colorado find the right mobility option for their needs. That also includes services through the Older Americans Act, and their funding for the services is through Older Americans Act and grants for state and community programs on aging. However, their long-term strategic plan is to become financially sustainable. So grants from private foundations have increased significantly in recent years for saint transportation. Next slide. There we go. Our next case study was Volunteers in Motion, and that is essentially along the Florida coastline near Cocoa, Florida, which is where they are stationed. Volunteers in Motion provides a safe and reliable transportation option for people who are living on their own independently, but have little family to help them, and those who currently are unable to use Space Coast Area Transit System. So that's Brevard County's public transit system. They offer fixed route and paratransit buses, and so Space Coast is really targeted towards those individuals who do not use the current transit system. The program's volunteers provide an extra level of assistance and support to get riders to important places like medical appointments, pharmacies, grocery stores, and the like. They are volunteer-based and cost-free to the rider, and neither volunteers nor clients incur any expenses as a part of this volunteer program. Space Coast Area Transit covers the fuel and maintenance contract with a third-party provider managing vehicle maintenance for the vehicles in the program. Expenses are typically under $1,500, or expenses under $1,500 are handled directly by maintenance, while Space Coast Area Transit covers any costs exceeding that threshold. Insurance coverage, which is important, includes both vehicles and volunteers, with volunteers protected under the Brevard County Workers' Compensation Program. One thing that is notable about this particular case study is that volunteers are not permitted to use their personal vehicles for service. So that way they ensure uniformity and liability coverage. The program currently has approximately 20 volunteer drivers, with 15 actively volunteering at any given time. And volunteers have to provide at least 1 week's notice when regarding their availability, so that way they can schedule efficiently. One of the most notable things, and my favorite fact about this particular program, is that Volunteers in Motion partnered with the City of Satellite Beach Fire Department's Community Paramedic Program. Sounds like a mouthful, but that is to say that these firefighters and emergency management technicians often volunteer as a part of this program. And the thing that makes that great is that if we are transporting older adults or individuals with disabilities, and there happens to be an emergency come up, there's already someone, your driver, who is qualified to help in the event of an emergency. And so that collaboration has facilitated connections with prospect volunteers and potential clients, especially those in need of specialized transportation service. And so the other thing that is of note is that if you're familiar with this area and have driven along the coast of Florida, it's long. There are a lot of traffic lights, and it can take a distance to get from north to south. And so what they did was station vehicles along the service stretch. So that way there are some vehicles scheduled on the north side, some on the south side. And so volunteers can access the vehicle that is closest to them to be able to provide that service. Next slide. Our next case study is WEX Express New Freedom, and that's in Cadillac, Michigan. That service began approximately 8 years ago when local groups in Wexford County identified significant transportation gaps affecting older adults and veterans. So while the county itself has a hospital, it lacked specialist care. And so that meant that the residents had to travel to larger medical centers, such as the University of Michigan Hospital in Ann Arbor, which was located 3 hours away. So in response, the authority's executive director sought funding to expand transit services beyond traditional jurisdictional boundaries, enabling statewide transportation when necessary, which is pretty significant for this particular service. Their volunteer driver program operates under the WEX Express Mobility Coordination Office in conjunction with the local transit authority. They currently operate with 15 volunteer drivers who use their personal vehicles, and volunteers use, when they use their personal vehicles, they do receive mileage reimbursement as incentive to keep driving. The program maintains a comprehensive insurance umbrella that includes liability coverage for volunteers and includes adequate protection for both drivers and passengers themselves. WEX Express does have a mobility manager as well as a mobility coordinator. So they manage complex transit trips for those riders with special mobility issues and determine the most appropriate transportation method, whether through volunteers, transit services, or external programs for specialized care, such as nursing assistants. Next slide. Our next case study is Nevada Rural Counties RSVP. They are one of our longest running services. So for over 50 years, the RSVP program provides escorted door-to-door transportation for those who would otherwise be unable to access essential care and resources through the Independent Living Transportation Program. So their program includes homemaker services, respite care, senior companionship, and emergency response systems designed to support independent living. Folded into that larger program are their volunteer transportation services. So they are affiliated with AmeriCorps Seniors and benefit from state and federal funding through the Nevada Department of Transportation and also through some formula funding 5311 for rural areas. They also have funding through the State of Nevada Aging and Disability Services Division and Funds for a Healthy Nevada, which is the Department of Health and Human Services. They also have foundation grants and donations. And they are one of the larger programs we've seen outside of WEX Express that we just discussed. Next slide. Our next case study is Ride Connection in Portland, Oregon. They are also a long-running program. They were founded over 35 years ago as a volunteer-run organization. Ride Connection emerged from the need to provide mobility services to older adults and individuals with disabilities before the enactment of the Americans with Disabilities Act. Initially, the program collaborated with senior centers that had wheelchair-accessible vehicles, but over time it expanded into a comprehensive agency offering multiple transportation services. Ride Connection services primarily cater to individuals age 60 and over or to those with disabilities. The programs include volunteer transportation, travel training to teach public transit use, a gas reimbursement program for family caregivers called Ride Together, a Ride About shuttle services for those social and shopping trips that are needed, and a community connector fixed route shuttles filling in gaps in city transit. So the agency also offers guided social outings for older adults. Ride Connection itself is a network of agencies dedicated to serving older adults, individuals with disabilities, low-income individuals, and the general public with transportation services in 3 counties there in Oregon. And then the Portland metro area itself is divided into 8 regions, each of which has a designated volunteer ride provider. Next slide. Our next case study is in Illinois, and it's Compass, Illinois, also known as New Freedom, not to be confused with WEX Express New Freedom. Compass IL, I'm sorry, they're in Wisconsin. Their New Freedom Transportation Program got its start in 2003 when Compass IL, which was formerly known as the Center for Independent Living through Western Wisconsin, collaborated with a local advocacy group to secure grant funding through the United Way of St. Croix County. Initially, the program operated as a traditional voucher system, but over time, it became evident that many individuals face challenges in securing rides through that method. So to address the issue, the program partnered with the Hugh Anderson Foundation, which provided $12,000 in grant support to fund transportation services. They initially cover 42 counties in Western Wisconsin, and then they require coordination across numerous agencies and organizations in the region because they have such a large service area. The organization itself employs 4 dispatchers, all of whom are cross-trained in dispatch operations, and they employ a billing clerk and a coordinator. Also, a licensed staff member ensures compliance with record-keeping requirements, and an additional dispatcher is expected to be hired very soon, if not already, given the timing of this webinar. The program does have 2 wheelchair-accessible vehicles, but volunteers typically drive their own vehicles. The other thing of note very recently that has happened is hospital closures, particularly in rural areas. And that has certainly increased the need for long distance medical transportation, particularly for dialysis patients. So these types of programs particularly in this area, are needed more now than ever. Our next case study is King County Metro, their community van in Seattle, Washington. And they have a pretty vast program. Similar to RSVP, they offer a number of, I would call them offshoot programs. So community care, coordinating with the suburban areas to ensure that people have rides to where they need to go, offering training and other things that are needed to be able to provide the service. They definitely offer wheelchair securement training, and that is something that is in common with a few of these programs for drivers that are operating wheelchair accessible vehicles and the volunteers that are operating wheelchair accessible vehicles. And they are in the process of growing. One of the things that they mentioned that they're looking at now is the possibility of the medical escorts. And so that was one of the things that I briefly touched on when we were going through what section 1, which is the sections of the book. Medical escorts are something that they wanted to look into because there were a number of riders who would either be headed into a medical procedure or coming out from a medical procedure. And that medical procedure or treatment may have required some type of anesthesia. And the challenge that they were faced with is that at the time they couldn't have another individual riding with that patient. And so now they're looking into the possibility of having a medical escort, which we thought was fairly unique to this program, but apparently is much needed in a variety of areas. All right. And last but not least is our Drive a Senior in Austin, Texas. And if you're familiar with this area, this program has been through a number of iterations. Previously, they used to work significantly with Austin Groups for the Elderly. And then they went through the iteration where they are Drive a Senior. And I'm definitely going to have Paula chime in on this one in a minute because she was following up as these changes were happening in real time while we were creating this toolkit. But originally, we had interviewed and included one volunteer program for the toolkit, and that was Chariot. But as we neared our publication date, there were 3 major volunteer driver programs in the Austin area. So there's Chariot, Senior Access, and Drive a Senior. And here you see the pictures from Drive a Senior. And essentially over the last year, what happened is that those 3 programs merged into a single program, a unified organization called Drive a Senior. So here you can see some of the pictures from Drive a Senior and Chariot. And then on the next slide, I'll explain a little bit more in detail about the 3 programs themselves. So here you can see the logos for the 3 programs, as well as the areas served on the map. And so there were a variety of nonprofit organizations operating in the capital area to provide services. They had very similar cultures and philosophies, and they felt it was appropriate to join forces to serve areas in and around. I'm going to apologize for my dogs barking in the background. So the case study focuses on the newly unified organization called Drive a Senior to ensure that it is stronger and more sustainable while remaining true to the organizational mission, the original mission of each of the 3 legacy organizations. With that, I'm going to turn it over to Paula because she has the latest information on this particular case study.
Well, thanks, Meredith. Yes, this is happening in real time, and so the map is not the greatest map in the world, but I hope that it shows the coverage now that these organizations are able to provide under one unified organization. And the other thing is that I think with publication of this toolkit. We were able to provide a link to Drive a Senior, but if you click on it now, you will see this map. In the next few days, in the next week or so, they'll be opening up a new website that will probably still take you out to the individual legacy websites, but they're working on it. And the other thing I can tell you is that the people that I've met here locally are thrilled that these organizations won't be competing for funding any longer. that they'll be able to do this together.
So, yeah, thank you, Paula. Let's dive into the common themes in section 7, and then I'll hand it back over to Paula to wrap us up. So there were a number of common themes that we found throughout all of these programs, and those included driver incentives, training, risk management services, software, and medical considerations. So some of the key findings that we found about driver incentives include their mix of basic motivations. The one thing we heard in common from every single program was that the volunteers themselves didn't feel like they needed incentivization to be able to provide the services. They were happy to volunteer. They loved meeting new people and driving and getting out. A number of the volunteers themselves are actually older adults and who are retired and just wanted to meet new people. And so they really didn't require a bunch of incentives to be able to provide the service. As far as training strategies, their approaches to training may differ, but all the volunteer driver programs included in this section of the toolkit have a shared understanding of the necessity and the value of training volunteer drivers. So some of the case studies, as I mentioned, include what would be PASS training, which would be the passenger securement training. Some of them might have specific structured training programs, but all of them did make an effort to provide some training and road testing of the volunteers that work through the program. As well as risk mitigation through training and communication. So some of the risk management strategies that were shared by study participants included the use of insurance, background checks, clear communication, and then a common approach to managing risk across the volunteer programs. And so that is delved in a little bit deeper in the toolkit as well as the appendices. Software pretty much ran the gamut. There were a variety of softwares that were considered as a part of the volunteer driver programs. There wasn't necessarily one software that they recommended. They all had different methodologies for managing and documenting trips and scheduling trips. And last but not least, there were certain medical considerations that definitely came up as far as a common theme. So it could include training, client support, more specialized programs like we mentioned, the medical escort, medical chaperone program. And so those are all considerations to make sure that they are providing top tier services for the clients that need the service itself. So with that, I am now going to turn it, lessons learned. Let's hop to lessons learned. I'm getting excited because this toolkit's so interesting. Lessons learned. So there were a variety of things that were shared with us. And one of the questions that we sort of asked when we were going through the case studies is if you could do it over again, what have you learned? What would you change? What would you do differently? One of the things that came up quite a bit was volunteer engagement and retention. So stressing the importance of recruiting the right volunteers and maintaining commitment. So the sustainability piece is big, particularly with the volunteers and keeping them engaged. Day-to-day operational efficiency included clear expectations, effective communication, which is critical when you have volunteers providing service, and then leveraging technology. Flexibility and adaptability was key. So programs need to be flexible in their service offerings, as well as how they're going about offering service and with the way they're growing. We found that the most successful programs that survived the pandemic were those that were able to kind of ebb and flow and go with the changes, and they were able to modify service to be able to continue providing services throughout the course of the pandemic and then continue providing services in this post-pandemic world. One of the things of note was the Space Coast Volunteer Transportation. They actually had no instances of COVID being spread at all because of their use of PPE. So that was kind of one of the lessons learned with safety and liability management. The rest of these you can learn about definitely in the toolkit and the appendix. There's so much to cover, but we're running out of time. So I want to pass it back over to Paula. If you'll skip to the appendix slide there.
Hey, thanks, Meredith. So just very quickly, the volunteer driver programs that Meredith was just describing to you were so very generous with making available many of their marketing materials, policies, processes, procedures, and forms. So we've got those in an appendix for you to review in the in the appendix to section 7. Next slide, please. This section 8 is quite it's I thought it was marvelous in the 2013 version of the toolkit, the guide. And what we did here was we took those model forms, the policies, the procedures, and we updated them. We didn't start from scratch. So again, a thank you to those original guidebook authors. And I think the only thing to say here is that the materials can be freely downloaded and edited. However, some forms should definitely be reviewed by your legal counsel to ensure compliance with state and local laws and for liability purposes. Specifically, well, for sure, the risk management subsection and its such policies like confidentiality and others. Next slide. We included a very brief glossary here. And I mean, just a few terms used in the toolkit, but what we wanted to do, because the standard terms and acronyms are across the transportation industry, we point the reader to National RTAP's Transit Managers Toolkit glossary and to National RTAP's ADA toolkit with that glossary. We think that made the most sense. And then another reminder about additional resources. Every section of this toolkit, including section 7 with the case studies, has a very thorough section resources with links to online, to the websites of I think just about every topic that we have and that we included. Kara and Mariana, I think we're ready for Q&A.
I think you're right. Oops, I think you're right. We don't have anything in the chat, but we would like to open it to anyone who would like to raise their hand. Go down to the little heart symbol where it says react at the very bottom of your page, and you should be able to see a raise hand feature. And certainly I would be happy to call on you if you have any questions. And while we're waiting, I want to thank Meredith and Paula for their incredible work on this project. And I think that one of the things that distinguishes this from a lot of toolkits out there is that the expectation is that you really might not know anything about transportation, but you can learn it as you delve into this. I love the aspect of volunteer driver programs because they really are a neighbor to neighbor. And we are able to take this from neighbor to neighbor and make it into a program that actually can be sustainable. Let's see, Alyssa. Thank you for that. Alyssa Cronin says, this isn't a question, but a thank you. Wanted to pass on to everyone to WashDOT. And I'm really thankful for that, that encouragement, Alyssa. That's very kind of you. We thought it was very important. And today, this is one of those things where neighbors are really helping neighbors. And this is really great for us. So we want to see people be successful across the country. So let's see, I'm just taking a look here at questions and answers. Did you study door-to-door transportation? Cynthia, thank you for that question. We didn't do that specifically. Typically, again, it's a risk management issue, but what I want to encourage you is to take a look at the volunteer driver programs near you and or in the case studies. Each case study includes a link to the actual website and individuals that can answer that kind of question for you. So, so I would go there first. Again, risk management is a big deal. So going door through door opens some other doors. Kara, do you want to pop in here as well?
I was going to say, Mariana, I can chime in.
Okay.
If you
Go
don't
ahead.
mind, like pun intended with the door, opens doors for liability. Most of the programs that we researched do walk the passengers to the door. But once you go through door, that is where you're opening up a whole level of risk management, as Mariana mentioned. And so it's not that we didn't necessarily look to study those, it's that none of them were seeking to provide that type of service because of the liability it involves.
Thanks for that, Meredith. Kara, did you want to add anything more?
We do have information about door to door and door through door in our ADA toolkit. So you can take a look at it there. Also, we just got a question about, is the toolkit live? It certainly is. I will say that it's been taking a little while to get the full 350-page one document up, but we make everything we have 508 compliant for persons with visual disabilities to read. So as soon as that is completed, you'll be able to see the toolkit, one and all pages, one right after the other, but now it's in web page format, and it's being updated all the time. Whenever we see a broken link, we immediately update it.
Thanks, Kara. Yeah, boy, I just encourage you to go to the National RTAP website and do take a look at the toolkit and go through it. It's really pretty easy to navigate, and I think you're going to find answers there that you didn't expect. So that's really exciting. Cindy, thank you for your question. What kind of training should volunteers receive to be a medical escort? Boy, as far as medical escorts, I know, Meredith, you alluded to the program in Seattle with King County Metro and the King County Mobility Coalition. Do you want to speak a little bit more to that?
Sure. I mean, what I will say is we need to be mindful that that is in the early stages of research. And the reason being is because of the aforementioned question about door through door services and some manner of liability. Essentially, what at a very high level, those types of medical escorts would need to be trained like as in pass training. So the passenger securement training. And then there was another type of training, and I can't remember specifically what they called it, but I know that Saint was doing this, and it's essentially like a passenger sensitivity training. So those passengers that have specific or sensitive needs, those volunteers are trained and able to provide that level of service. There is, interestingly enough, a medical escort volunteer training video that is on YouTube that is a little dated, but ahead of its time as far as this discussion goes, highlighting the roles and responsibilities of volunteers when they're escorting medical patients. Some of the things that might be needed would include perhaps CPR and first aid certification, which is why the Space Coast volunteer transportation is significant as far as some of the volunteers being emergency services. So again, it's early stages. I don't know that there's necessarily a standard for medical escorts at this point in time, but those are certainly some of the considerations as far as training. Does anyone else want to add?
I would just add quickly too that that the organization in Washington did agree and actually ask us to include the white paper. They don't, because their white paper includes a lot of information that they collected as they were thinking they were getting ready. They were, like Meredith said, in the initial stages, but their white paper does include a lot of information that they gathered to even start to think about having someone to an escort, a medical escort. So there is a link to that.
That's great. That's great. We certainly, as I put in the chat, we certainly can connect you with that particular program, but it is in the volunteer driver program and you can ask directly. Alyssa asks, do most volunteer programs you studied charge for services, and how do they typically fund liability and or operating expenses? I'm going to answer just quickly. That depends on the area, and let Paula and Meredith address that a little bit more.
Paula, do you want to go first?
One of the things I would say is that I don't know why I wasn't really surprised by this. I was delighted, but the organizations that we were able to interview were incredibly transparent. Their funding sources, how they are able to braid dollars together, most of the time appears on the individual websites. And everyone that we talked to, I think, was certainly willing to talk about how their supporting organization was helpful to them. I think we only maybe had a couple that didn't have a real supporting organization. And so sometimes the resources, like the legal resources, insurance resources, had to do with them being plugged into a larger supporting organization. Maybe the AAA, in some places the public transportation system resources. Meredith?
That's correct. A number of the programs to be able to afford that liability and operating expense are those that have some type of umbrella, or what I would call a parent agency, or even a partner organization, such as Saint with the MPO. So those that are the most sustainable and are able to retain that funding and find sustainable funding are the ones that have a parent or a partner organization. As far as charge for services, the broad answer I have is no, there's not a charge for service. In a lot of cases, sometimes they'll ask for donations. And so if they feel a donation is appropriate, then they take donations. So I remember one of the stories that someone was telling me about is that there was an older gentleman who just simply did not feel right riding along for free, even though it was a volunteer transportation program. And so he wanted to give $1 or $2 here or there when he could afford it because he felt the service had value. So 9 times out of 10, you're going to see that there is no charge or it's donation-based services. I believe in some of the research, the only programs that we saw that require like a membership fee are those very broad programs nationally. Like I believe it's ITN and the like, as opposed to these singular programs. Hopefully that helps answer your question.
Yeah, and I would only add this, that I think the goal in probably the vast majority of these programs is to provide these rides for free. If your next door neighbor asked you for a ride, you're probably not going to ask them to pay you to do it. So that's way down at the granular level, but that's really where volunteer driver programs start, is at that granular relationship level. And so the idea of charging for that service is probably not going to be the norm in, I would say, the vast majority of these programs across the country. Any further questions? We're looking at just a couple more minutes here.
Yeah, you can do questions.
Yep.
Yep.
So while we're waiting for anyone else to pop in with a question, Meredith and Paula, were you surprised by anything when you created, when you went in? I'm not sure what your expectations were when you started on this project, but were you surprised?
Paula, do you want to field that one first?
Well, I'll tell you, because we did have opportunities to present this toolkit as we were working on it. We had the opportunities to go, and invited us to go out to. I'm sorry, I'm going to blank on the name of the conference, but we were able to go to Colorado, we were able to go to Washington State, and we were able to present very recently here in Austin. And I think what surprised me the most was how willing the folks who had volunteer driver programs were to share with other people. They couldn't share enough. And I feel like the networking that happened in every one of those conferences was amazing. And I think everyone went home feeling a little more confident that they could do this.
Yeah, that was one of the things I was going to add on, if I may. I initially started studying volunteer driver transportation programs when I was with TTI, Texas A&M Transportation Institute, and that was well over a decade ago, almost 15 years ago. And I think the thing that surprised me the most is the number of programs that are out there really providing this web of services where there are true gaps in transportation and how much they are doing and how sustainable they are. I never imagined that we would find the wealth of information that we did. And so I really do hope that everyone who is attending or listening to this recording, this webinar in the future, digs into the toolkit because there's so much information that we couldn't cover today and a wealth of info to learn from. Kara?
Yes, definitely. I hope you all go to the toolkit and keep asking the questions after the webinar. We do have one final question, Mariana, that we have time to have answered.
Okay, Cindy asks any thoughts on programs such as GoGo Grandparent, a subscription-based transportation program. And sort of sliding in behind Meredith with regard to closing transportation gaps. In my very short tenure in the transportation industry, I'm of the opinion, and others can jump right on in and disagree if they want, but really any program that creates opportunity for people who wouldn't be able to get rides any other way is a great opportunity. And GoGo Grandparent, I will speak to my challenge when my father was alive and he was in his 90s and still driving. And frankly, GoGo Grandparent was a great option simply because he was used to coming and going when he wanted to. And GoGo Grandparent is set up sort of that way. They don't have to wait for a ride. They don't have to other than it's like Lyft or Uber. And so in that case, it filled his need. He was able to get a ride when he needed it or when he wanted it, as though he were driving himself. So for him, that was a big deal. So but on the other side of that, when we're talking about rural areas of the country where dollars are not as readily available. I mean, we lived in the suburbs of Seattle. Consequently, we were able to pay for those kinds of rides. But on the other hand, if you were living out in the hinterlands of, Washington State, of which there are many, would that have been possible? Probably not. So, Cindy, I hope that answers your question.
Yeah, I would definitely echo what Mariana just said. I can't say enough good things about GoGo Grandparent. I think it works where it works. I personally have had to use it for a family member, and it's different than just a traditional Uber or Lyft type program in that the driver understood my senior adult family member's needs and was actually able to make a couple of stops for him when he needed to stop. Because he couldn't travel long distances for more than an hour, say, whereas with a traditional TNC program, they wouldn't do that. So I definitely think there is a place for everything. And this is just part of all of our mobility solutions that we have out there for our older adults.
Exactly. Well, Kara, I think we are at time.
Right. Those were all wonderful questions. So thank you for them. And thank you for our panelists for answering them. If you have any more questions, just send them to info@nationalrtap.org. We hope to see you at some of our upcoming events. Our Books in Transit discussion group is next week. Then learn about TACL, which I mentioned earlier, the Transportation Technical Assistance Coordination Library, tips to become a National RTAP Resource Library super user. That's not a toolkit, but it's a great tool. And then spring into new National RTAP resources. That'll probably be in April or May. So all we're going to do now is say goodbye and thank you to our wonderful panelists and toolkit preparers and all our reviewers and everybody who made the toolkit what it is. It's really an encyclopedic wealth of information, everything you need to know about volunteer driver programs. The last thing is the webinar survey QR code. You can, if you have your phone available, you can click on it. And like I said, you will get a email tomorrow. So we really do want your feedback about if this webinar was helpful, what is, and what else you want to learn about. Our contact information is here. And thank you for being such a wonderful audience. Have a great day.
Bye, everybody.